You are listening to Breaking the Waves, conversations about the Dutch pandemic. My name is Matt Cornell, and I started this project to provide English language commentary and analysis on the Dutch coronavirus policy. And today we're going to talk specifically about the role of Dutch universities, and in particular about the University of Amsterdam and how it has responded to the pandemic. My guests today are Dr. Vivienne Matthies-Boon and Dr. Pallister-Wilkins. Vivienne Matthies-Boon is a professor by special appointment in humanism, Europe, and global justice in the Department of Philosophy, Theology, and Religious Studies at the Radboud University of Nijmegen. She's also an assistant professor in political science at the University of Amsterdam. Her work is rooted in German critical theory and French existentialist thought, and she investigates the interrelation between oppression, violence, suffering, and existential vulnerability. Her book, Breaking Intersubjectivity, Counter-Revolutionary Trauma in Egypt, is forthcoming within Rowan and Littlefield's Radical Subjects series. Dr. Polly Pallister-Wilkins is a political geographer and associate professor in the politics department of the University of Amsterdam. Her research is situated at the intersections of humanitarianism, mobility and justice, and border violence in the contemporary and continuing colonial contexts. She's currently working on a project on the necropolitics of the Dutch COVID-19 response with Amina Ali and Sarah Brock, alongside researching the intersections of pandemic response and racialized carceral politics in the Greek governing of refugees on Lesbos, as part of the Horizon 2020 Advancing Alternative Migration Governance project. Our conversation was recorded on Friday, April 30th, 2021. Polly and Vivienne, I want to thank you for joining me today on Breaking the Waves. And just to give a little context for our listeners, despite the fact that the hospital system in the Netherlands is overwhelmed, the Dutch government recently announced easing of a number of coronavirus measures. Among those was allowing universities, higher education, to resume face-to-face, that is on-campus teaching, in a limited sense, starting from April 28th. And of course, the University of Amsterdam immediately announced that they would be doing so. And you both have been quite critical of this and have argued that the university should not reopen until everyone, students and staff, have had access to vaccines. Can you tell me, Polly, why you made the decision to speak out?
It was in response to two things. Firstly, the very slow rate of vaccination in the Netherlands, which doesn't seem to have gotten any better, and to discussions both at the national level, at the political level, and also at the level of the institution, at the UFA level, around, reopening campus, allowing students to come back to campus, having more on-site, on-campus teaching opportunities, meetings, et cetera, et cetera. And I think we thought that, to be done, for all of us want to get back to campus. Of course, all of us want to get back to how things were, if that is possible. But, all of us want to get back there, but we want to get back there safely. And we want to do so in a way that puts the needs of the vulnerable first, and does no harm. And I think, we saw vaccination as the safest and most egalitarian way, actually, of getting to that return to a safe on-campus teaching, learning, research environment.
Because what you were arguing for is vaccination, not just for teachers and students, but also for support staff, anyone who is in the building. Yeah. Okay.
Yeah. Absolutely. Yeah.
Yeah.
And also, maybe it's worthwhile pointing out here that we basically asked for the universities just to be cautious in opening up any campus or whatever until everyone has had access to vaccination. Because I think it's also important here to realize, you also have bus drivers, you also have other sectors or cleaners, anyway. So there wasn't this call for the prioritization, but it was rather saying like, let's just wait, let's put on the brakes a little bit, also so as to be able to keep actually the education going, because we've already had several colleagues that were sick long term and have really terribly disabling effects of long COVID that have just been really, really terrible. But it also means that suddenly other staff have to jump in and do their teaching as well, who are already overworked because of the underfunding and the way that the education system is structured. And then, asking them to jump in and then adding the risk of further illness of staff basically could very well mean that the whole education system would start to collapse, in the sense of we need to be able to keep it going. We need to be able to keep the ship afloat. And opening the universities would pose a real threat to that, as well as also actually the exclusion, whether intentional or not, of staff and students who have more vulnerable physiques and or other situations at home and other things that makes it more impossible for them. And really we need to be careful so as to not marginalize precisely those who already find themselves in a very vulnerable position, whether that's through social relations to others who have health issues as well as themselves, as well as the recognition that also it's often in the Dutch context, it's often said like, oh, it's only the elderly, which of course is not true, and only those with underlying conditions, which is also not true, and is also, even if that was true, you often don't know if you have an underlying condition until you actually contract the disease. So this is no guarantee. If you think you don't have something now, you can discover it later on. So it's to kind of account for those things, I'd say, as well, and say, well, basically sort of like hold your horses. Let's make sure we do this properly, and not rush ahead.
Yeah, and I think, in terms of it's only the elderly or those with underlying conditions or those who are medically vulnerable. I also, for me personally, from a sort of ethical and a political standpoint, in which I try and, in my work and in my approach to my professional life, but also my personal life, practice a sort of feminist care ethic. I don't want to have a policy that excludes the most vulnerable, right? I want a policy that is built around the needs of the most vulnerable and puts their needs first. I don't want a kind of a strongman policy that perpetuates an ableist societal cultural norm. So for me, I think that was really, really important. And I think, to sort of re-stress what Vivienne said about, it wasn't our sort of tying reopening, getting back to campus on the need for vaccinations was absolutely no way a call for us to jump to queue. I know that in other contexts, so in the US, for example, educators have been privileged and given the vaccine before others. I know in Italy, the same thing has happened. And there's structural reasons for that as well, right? Different structural contexts. But I think, we were very clear that, no, this should happen. We all wait our turn, but we will get the vaccine, inshallah.
Yeah.
At least that's what we've been told. We might have to wait a bit longer. And, when we've got it, we can get back to campus. And we are, yes, it's not ideal teaching online, but we can do it. The structural conditions enable us to teach online, where in some places they don't. So that's why vaccines were sort of privileged for education purposes more. And of course, as Vivienne said, this doesn't exist in a vacuum, right? The existing structural issues affecting our teaching, budget cuts, et cetera, increasing work pressure, which is a concern and, is a flagged concern by management at UFA. COVID just compiles and piles and piles up on that. And of course, that has to all be taken into account when thinking about policy and what to do.
I'm happy that you mentioned the sort of implicit ableism in this push to get back on campus, because I also think that there's a sort of a problem around privacy too, which is if you are in a risk group, or if you do feel like you're more vulnerable, we should be clear, everyone is in a risk group for coronavirus. Nobody has defenses against it. Anyone can get sick. But if you're in a risk group, it's kind of on you then to tell your employer or to tell your teacher, which of course is a problem. It's not a position that anyone should be put in. It's a position that I had to put myself in order to, because the campus that I was teaching on last year decided to go with a hybrid model. And for our listeners, what that means is, half of the time students and teacher are in a classroom and half of the time they're at home on Zoom. And this is to limit the class size, right? And also to give students some classroom time. That's how most of the classes went. And of course, I had to lobby very hard for all online for myself and my own classes. But this is another problem, is the sort of way that it requires people to disclose their own medical vulnerabilities, their own private medical histories, which is ironic because by the same token, the university is not going to require anyone to show a negative test to go on campus. And we should, for our listeners, it should be very clear, we're arguing that campus shouldn't reopen until students and staff are vaccinated, whereas I think in the university system in California now, California State University in the United States, and also UC system, they're requiring proof of vaccination in the fall. So what we're arguing for here is really only access to vaccination. Seems like a fairly modest thing to ask for in this context.
No, it is.
Yeah.
And also that was, I guess, part as to, make sure that, you don't have this backlash, really. I mean, let's just be frank about it. There is a very hot backlash of the anti-vaccination camp. And it's, rather than sort of heating up those debates, it's basically, and it has its own problems, right? But I think also this notion of disclosure by those who are vulnerable, that's precisely the biggest problem here. I've also had students who have serious health issues who already before Corona, occurred, were already in a sort of a marginalized and quite a vulnerable position, who really were struggling with the way that others, for instance, treated them already because of their illness. I mean, other students, other staff, etc. And then to be further, having that push to further disclose your problems. The problem is that it places the burden on you as the individual. And this is also where I think it fits in with what I would call this neoliberal sense of subjectivity and responsibility, which is that social structural problems become your own individual concern. And this is where we also see this notion of the strong ableist person, the ableist subject, being reproduced internally also within people. So if you don't live up to this image, if you don't have a body that is this strong, then there's something wrong with you. And so it really holds up this ideal of, basically both existential and physical certainty that you can make it. And that actually what we also see is that both in the far right camps, as well as these esoteric camps, which have started to merge, is that they also started to push that blame agenda more, and that has become integrated more into this whole debate, namely that if you are not healthy, it's your own problem. right? Is it like then either in the esoteric camps, which we now see, as I already said, combining with the far right more and more, then your chakra is not in the right place, or you're not thinking happy thoughts, or you are not in the right state of mind. It's this kind of individualization of health and of your body and of yourself that is extremely problematic, because it's completely not realistic in terms of the actual existential uncertainties we all face in life. And I think personally, if there's one thing that COVID should do, is actually for us to realize that we have the existential uncertainty, that actually we don't have control over our lives, that actually we are fundamentally not in control in life, and life is not, as we say in Dutch, maakbaar, which, to be honest, I haven't found a good translation for in English, which is sort of like, it's often been translated as like manufacturability, which is not the right term. It basically has this sense of everything you do can be made by your own effort, your own thing. And it's just, that's not reality. And that's what's been reinforced in this image. And so I think also in that sense, personally, I think it's important to, obviously, there's the issues around the universities and whatever, but this plays on a much bigger level. And that what takes place at universities is also part of how the debate is structured in society. And that precisely is structured about the complete, I wouldn't even say negation, but the complete ignoring of existential uncertainty. Because if you negate something, you basically have to recognize it and go against it, right? And say, okay, yeah, it's there, but we're not. But that's not even what we're doing. We are in the Dutch debates. It's very much like we just pretend it doesn't exist, and that if it happens to certain people, and they are either useless because they're old, which is not true, obviously, or it's their own fault. And so they should have, I don't know, sang mantra songs, or should have had this strong body or whatever.
Also, the ableism that you're discussing, it's a part of a lot of the policies that are already in place. So, for instance, one of the messages that I've seen coming from University of Amsterdam, for instance, is, of course, it would be better not to take the elevator, because, of course, the elevator is a confined, poorly ventilated space. The university itself had a study come out last year about aerosols lingering in elevators. And so they encouraged people who were going to campus to take the stairs. And of course, this gave me flashbacks to these signs that were put up around the University of Amsterdam several years ago that said, burn calories, take the stairs. Which, aside from being fat phobic, were extremely ableist. So here they are again, sort of saying, hey, if you want to avoid the risk of contagion in the elevator, which is something that we could have helped prevent through better ventilation or whatever, take the stairs. It's better for you anyways.
Yeah, I think this does. And I'm speaking as somebody who's lived in the Netherlands for nearly 9 years, but comes from the UK and New Zealand. I think Dutch society is generally very poor when it comes to providing facilities for disabled people. Amsterdam as a city, if you have to try and navigate it, if you have a disability, is almost impossible. If you are in a wheelchair, or you are trying to use some kind of accessibility aid, it's just really, really difficult. But I think I want to go back a little bit to what Vivienne was talking about in terms of the individualization of risk, the individualization of illness and of health, and the way that this absolutely erases or fails to take account of everything that we know, as social scientists, around the socioeconomic drivers of health.
Yeah.
As well, right? So, we know that, and we have a lot of, in our university, in our department, in our faculty, we are concerned about the ways in which certain, socioeconomic classes, people of certain minority racialized backgrounds are excluded from the university, especially from the UvA. And we also need to take account, if we're able to recognize that, we should also be able to recognize the way in which health outcomes, as we know, are also, not always, but, are very much linked to social class, which is, of course, racialized in the Netherlands, whether people want to admit it or not. And that, these also need to be taken seriously. So, the push to individualization in this way, the push to, this sort of eugenicist strongman, is also a way to push a neoliberal agenda that works to absolutely erase the violences, the embodied violence of, racial capitalism, right? That leads to differential health outcomes for people. And we know that COVID, even in the Netherlands, we know that COVID has disproportionately impacted and affected, migrant, immigrant, minority, racialized, working class groups of people. And there are very, structural reasons for that, that we need to be aware of. And I think as a university, and I think as educators, we have a responsibility to try not to reproduce those structures and those exclusions, in our approach to COVID. And I don't think we've been very successful at that.
Right. And unfortunately, the discourse, to the extent that there is a discourse about this unequal distribution of suffering from COVID, it's again framed as personal responsibility. So, maybe people in these poor migrant neighborhoods don't know the rules, or don't wash their hands, or something like that. And it's never about these systemic or structural inequalities.
Yeah. It's never about the fact that they have to go to work. Right? Yeah, because they don't have the opportunity to work.
And what kind of works do they?
And what kind of work they do. And I think that's also a reason for us, because we can work from home and can stay at home for, if you build a policy around the most vulnerable, which includes those people, who have to go to work at Albert Heijn, right? Who have to drive the buses, who have to drive the trains, who have to clean the streets, who have to, cannot do their work from home. Or staff our hospitals, we should not be taking up space, going on public transport, right? Because when we talk also about coming to the university, we're not just talking about what we do in the university, we're talking about how we get there. And it might be very fine for me as somebody who lives in Amsterdam, who can just hop on my feet and cycle across the city. That's one thing. But what we're also asking and expecting students and some staff to do is travel actually really long distances across the country in public transport, increasing their exposure and their risk, but also, of course, increasing the risks to all the other people who have to use public transport, who have to be in these spaces, that don't have a choice, right? And because we can still do our jobs online. We can, thank to the modern technology, Zoom, thank you. Never even heard of Zoom, this time 2 years ago, even 18 months ago. Because we can do that, we should, right? We have a social responsibility. And unfortunately, the individualization of that, it fails to take account of that bigger social responsibility.
But I think also here it might be worthwhile at the same time pointing out, just to kind of add some nuance, and we wouldn't be in favor, for instance, of keeping the university buildings closed, right? Because you do have students from vulnerable backgrounds who need a place to go to for whatever reasons, that also they should not be forced to disclose. There could be all sorts of reasons. The other thing is that also we weren't definitely not against this idea of having no activities on campus, but just not structurally tying it to teaching, at least, and also not on a big scale kind of thing. Don't start.
That's building your policy around the most vulnerable.
Yeah.
And if you don't need to be on campus, you don't go. right?
Yeah. But I mean, we
For those that need that space. They need that safe space. They need access to those resources because they don't have them at home. They don't, all of these kinds of things.
And also there's other ways in which, some smaller activities, for instance, outside or whatever, could be arranged that is not, at least not structurally tied to teaching. And so structurally embedded within the university in that kind of way. Not negating the fact, of course, we would all love to be back and engage with the students. And, sometimes I do wonder also, like when I see them, how tall are you actually in real life? Because I've had like several loads now and I have no idea, how big they are or how,
You've never seen them from below the neck.
Yeah, you never have any idea. So, I mean, in that sense, of course, we'd all love to go back. But I think as universities and actually perhaps not even just universities, but any education institution that can do this, think about this and, cleverly in a way, think about what we're doing.
I should also say that students have not been overly critical either of the university. All I get is international students, yes, but the Dutch students have been overwhelmingly positive about returning to campus. So it's a problem.
But in a sense, that's not surprising, no? And that's the main debates that they are subject to. I mean, even if I look at others in my close surroundings, they more or less echo in a variety of different forms or whatever, but basically they mirror what the Dutch debates, the public debate tells them. And so even when I press long COVID in their face, it's like, what are you talking about? It's sort of, and that's also my concern, is that the Dutch debate is also very much centered on that the risk that is there, that it's only limited to the elderly and the already sick, which, I mean, as I already said earlier, is nonsense because it's just not true. But also there's really an underplaying of the impacts of long COVID, both on people, of our age in their 30s, 40s, 50s, but also actually on younger kids, teenagers, but also children. And what I find striking about the Dutch debate as well is that there's a lack of willingness, because, I mean, really it's not ability. Anyone can read English to this level, but just unwillingness to engage properly with even just the public debates as they are occurring in the countries right next to us. And here I'm talking about the UK and Germany. In Germany, it's very clear that children at least teenagers, are now on the plan for vaccination. And Merkel is very deeply concerned that children are not part of that program yet. Such a concern. I mean, this is also where you see a striking difference between having a chancellor who has at least a scientific training and background, who understands, what's going on, and then, Rutte and de Jonge, who basically just ignore this again. And so what's then regarded as a risk is basically very limited to a select few people. And there's a complete, ignoring of that actually it impacts us all. And there's also a lack of willingness, for instance, to engage even with the British statistics from the government of how many children get long COVID, what happens to these children who get long COVID. I mean, that is not only here, there's also continuous underplaying of the fact that it's a SARS virus. That is not a flu. A SARS virus is something very different in terms of, how it's structured. So it's really, I find that really rather, and especially for a country that is supposedly, international and also engaged, particularly with Germany and the UK, trade and all that. Where does that end up? Where does that go?
I think, again, what you said also goes back to this whole issue of the individualized nature of the way that the Dutch are treating the pandemic, right? Which is get a vaccine if you want one. And of course, we know that the vaccines at best have a 95% efficacy, which means that the more people who are vaccinated, the better. Yep. It's not like your risk goes to zero if you're able to get a shot eventually here. So this idea that that we may go back to campus in the fall with only a fraction of people vaccinated, that's not good enough.
No, it's not good enough.
And again, I mean, then the thing with vaccines and building herd immunity through vaccination, and why people should be vaccinated for any of the diseases, illnesses you can get a vaccine for, is you don't just do it to protect yourself.
Yeah.
You do it to protect other people, and especially those people who cannot, for whatever reason, be vaccinated. Right? I mean, that's why we do it. Like, we do it to protect society. Right? And to, it's not just an individual form of protection. And I see that we're not having that discussion, and we're not, and in that sense, the vaccine discussion is mirroring the wider individualization of the approach of the Dutch government to corona and to the pandemic, which of course is very, very useful politically for Rutte and De Jonge, because they can then blame all the failures on individuals and individuals not taking responsibility. When, from examples of where, interventions to repress, to crush, to whatever the virus, has required a recognition, a public health response that understands that these kinds of illnesses can only be tackled with a collective societal level response.
And also, I think, sort of picking up on that or adding to that, I also think then what you see here as well is actually a kind of a strange conception of freedom, right? It's not actually freedom what they're arguing for, and not actually even individual freedom, but it's sort of what I would say almost like the selfish need to do whatever I want or as I please, which is something very different than freedom. Because if you just look at Kant, even, you're only free insofar as you don't hurt others. That also is freedom.
And the others are free.
Yeah, because then also the freedom of others is concerned. Otherwise, you're just selfish. You're just, and that's not okay. And that's precisely now freedom in this neoliberal subjectivity has also been reduced or transformed to this notion: I can do whatever I want because everything is my choice, and everything I make is, everything I do is makeable, as I call it in Dutch. And that's not freedom. That's actually a form of imprisonment, both of the self and others, because you're not recognizing that you yourself are actually vulnerable and that you're reliant on other people. And if one thing that the COVID epidemic has done is basically force us to come face to face with that vulnerability, because actually suddenly you're reliant also on other people, which who largely now don't, but abiding at least by social distancing, keeping the mouth masks on, not wearing them in strange positions on their heads, etc. It's kind of, these things also highlight vulnerability, as well as obviously through the disease itself that can impact anyone. But rather than facing those things head on, it's like, no, I want to have the selfish right to do whatever I please. And I'm sorry, but it's a bit like, my 5-year-old child. No, you cannot do whatever you want. This is not freedom.
But it's also a failure to recognize that, it's the agency structure debate. I'm sorry, but for completely failing to recognize that there is a thing called structure, and no, not everything is makeable just because you want it to be so. And actually, through this pursuit of individual freedom, or some people's idea of individual freedom, what they're actually doing is making other people less free, right? So whether that's vulnerable people, whether that's all of us, because basically if this pandemic just keeps going on at the level of like 8,000 infections a day, we are never getting out of this. And for somebody like me who doesn't have family in the Netherlands, I am stuck here. Fucking pisses me off. I have not seen my family for a year. My aunt is dying in a hospital right now of cancer. I will never see her again. Right? I cannot go to the UK unless I want to go into quarantine for 2 weeks, and then have to pay about £500 to have various tests to show that I'm COVID negative, right? I am stuck here. The last time I saw my mother was at my father's funeral, who died from COVID, by the way, But people will, of course, always ask me, oh, did he have any underlying health conditions? As if that somehow negates the fact that he died from COVID because the British government discharged ill COVID positive people into elderly care homes where there wasn't enough personal protective equipment and there was no concern for keeping the staff who worked in those care homes and the patients who lived in those care homes safe.
Yeah.
Right. So I am stuck here, right, while the rest of my family are all in New Zealand living a completely normal life, apart from the fact that I can't visit them unless I want to pay like $3,000 to go into a managed isolation and quarantine facility. And get a spot, which is also really hard, right? And I'm basically stuck here living in this kind of weird waiting for Godot, Beckett-esque kind of existence where we just keep repeating the same thing over and over again when we know that it doesn't work. And yeah, you can criticize the UK approach and whatever at certain points. It's been absolutely horrendous, but at other times, actually, the government has eventually listened to the science and the scientists and have actually recognized their mistakes and have not necessarily repeated them. You know, the same thing can be said in the US with the change of administration. Here, it's just, we just somehow think that after a year, doing the same thing is going to magically lead to, I just don't understand it. It's that it's an arrogance. It's like King Canute thinking he can sit on the beach and tell the tide to stop coming in, and that magically actually like Rutte and De Jong can keep saying the same thing and then magically COVID's going to one day disappear.
I'm really.
I got really angry then. But I'm angry.
I hear that, and Polly, I'm glad that you mentioned this feeling of being trapped, because it's a feeling that I've had for most of this period. And of course, I've been getting into arguments mostly online, obviously, with Dutch people who ultimately say, "Well, why don't you just move back to the U.S.?" And I can't. I literally can't. It's so frustrating that they can't see that, right? And that obviously in saying, well, if the U.S. is better, why don't you move back there? They're reproducing a very American-sounding discourse, which is love it or leave it, right? If you don't like it, leave it. And of course, I've said this before on this show. The U.S., of course, was one of the 3 worst countries to be in during the pandemic. I mean, after India and Brazil, right? Yeah. On the other hand, individual states. Individual governors and mayors had much stronger positions. And it was never about, and I think this is the thing that's frustrating for me in the Dutch context, the Dutch response is so much about the rules and what the rules allow us to do. And I know a lot of people who live in parts of the United States where the rules didn't require masks or didn't require X, Y, or Z. And people didn't base their behaviors on rules. They based them on responsibilities.
Yeah.
And what I find really frustrating here is even people on the left in the Netherlands tend to conceptualize things in terms of what they were allowed to do. Right? Yeah. Well, we're allowed to do this. And it's
no one ever asks, should they do it?
Right.
Right. Whereas the New Zealand response recognized that, you had to set rules, otherwise people would take the piss. So they set the rules really, really strict, right? Because otherwise it wasn't going to work. Because, people will always try and, manipulate the rules in particular ways. But it was also, the whole policy was then still also set around, needing to take responsibility for everybody and for the more vulnerable.
The University of Amsterdam, a couple of weeks ago, announced that they were opening a number of study spaces, which they were calling COVID-proof study spaces. What do you know about this? For
me, this is the first time I'm hearing of it right now. But
I know about it. You don't read the newsletters, Viv.
No.
Or maybe sometimes those things, they go to my other box on my.
I didn't see this.
So they claim that they can COVID-proof these study spaces, but it's really not clear how you can do that, right? And I mean, it's also to me a very dangerous claim to make, right? Because what happens if somebody catches? Well, we don't do tracing, right? Contact tracing. So we'll never know if somebody does catch COVID in one of these COVID-proof study spaces. But again, I understand the need, and we've talked about this, the need for, spaces and places to be made available for people who don't have access to safe, quiet workspaces at home. And, we know that students are, especially in Amsterdam, are living in conditions which are not conducive to being able to work from home. And again, that's a bigger structural issue around the Amsterdam housing market and the lack of student accommodation, et cetera, et cetera. So I think it's important that we provide those spaces, but at the same time to recognize, that they're not, how can they be COVID proof, right? I mean,
especially,
when you don't mandate mask wearing, when you don't, without a set of, very strict regulations, which would go some way to making that, a safer space.
Yeah, for what it's worth, I clicked on that link again this morning, a couple of weeks later, and now the language COVID proof has been removed. So maybe they realized it was kind of liability, because of course
it was a liability. It is a legal liability.
When I heard that they were opening up a bunch of small rooms for people from different households to gather without masks, I thought that's the opposite of COVID proof. That is actually COVID incubator.
Yeah.
So just one other question here. So
can I also just say something quickly on also the university?
Yeah.
I mean, and I find it disappointing in that, the UvA is a very large university. It is the second biggest employer in the city of Amsterdam. It is one of the, Europe's leading universities. It prides itself on having all sorts of expertise, et cetera, et cetera. And yet when it comes to setting COVID policy and COVID rules and regulations, they don't look to their own expertise, right? They simply reproduce and stand behind or use the government guidelines. This is cowardly, right? This is an abrogation of responsibility. You don't want to have to take responsibility, so you transfer responsibility to the government, when it's perfectly possible to make a set of rules and regulations of your own, which would actually better reflect the science, right? So we still have this policy, which is a Dutch government policy, that you only need to wear a mask if you're walking around, right? I mean, and then if you're sitting down, you can take it off. I mean, this to me is madness. Doesn't seem to follow any kind of scientific, any kind of science, right? All kinds of these kinds of things, when it would be very easy for the UvA to say, no, mask wearing at all times, right? That there has to be greater levels of ventilation, et cetera, et cetera. I understand they don't want to do that because that would cost money. Right. Yeah. So, of course, and there are structural reasons why the UvA can't spend money. And that's to do with the fact that higher education is structurally underfunded in the Netherlands. And so all of these things kind of create a perfect storm. But I do find it disappointing that, you have a collection of incredibly smart people, world leaders in this kind of thing that the UvA loves to celebrate. And yet when it comes to setting our own policies, we won't do so.
Can I just stick
that's disappointing
with this policy thing for a second? So of course now masks are required, at least when you're walking around the building, right, as you said. But up until December, until we got a mask mandate in the Netherlands, they weren't required. There was only this advice from, I think, September, that indoor public spaces, and I don't know if you remember this, but when Rutte said indoor public spaces, you should wear masks, the UvA came out with a statement that they would not be enforcing this because the university buildings were not a public space.
Yeah, I remember that. Yeah.
Yes. Yeah. And I mean, if they are a public space,
what do you think about
owned by the public and they are open to the public? There are some, there are many universities, at least in the UK, where, the spaces are not public, right? You have to swipe in with your card, this kind of thing. But the UFA buildings are all open.
Yeah,
right?
they're all
Apart
open,
from
and
maybe the
anyone goes.
library on the single where you have, but actually, you never have to swipe your card. You have to just go through the gate. There's a gate, but it's always open.
Yeah,
they're open to
I'm
the
just
public.
wondering,
they are public spaces.
It just sounded like a very
It's playing with the semantics.
Yeah,
it sounded like a very. Sorry, I couldn't hear.
it just sounded like a very extraordinary claim, like something that I think would require a lot closer analysis if this is the basis on which they're going to exempt themselves from.
I mean, I think that they obviously don't hold that policy now anymore, and I suspect, but I'm not. I don't know, that for them it was probably largely a pragmatic concern at that point, as in like I can, rather than I wonder, as in like, this will create a lot of fuss, so we'll try and limit that, and so we will now suddenly pretend that we're not, which is of course deeply problematic because, as what Polly said, the buildings are really very open, and to be honest, and so they should be, right? I mean, in the sense of universities, I would not be in favor of restricting access in sort of surveyed kind of ways. This is not what a university should be.
But even the dichotomy between a public and a private space, does COVID operate differently in a public or a private space? No. Right. So even if you only have people who are staff and students of the UFA in the space, which is pretty much, I don't think there are members of the public randomly all the time walking around the UFA, to be honest. I don't know why you would. It's not it's not a beautiful campus. At least the Rutus Islands is not a beautiful space. Why would that distinction actually even matter? Right? Yeah. Why does that distinction even matter? It doesn't make any difference, right? Because actually there are very few public indoor spaces in the Netherlands, because the Albert Heijn isn't a public space.
Yeah.
Right? Apart from maybe the library, the Ober, and the train station.
Well, even the RIVM recently claimed that its building was not public space.
Exactly, as to why they didn't have to wear masks. As if, again, COVID would work differently,
but also
in the public health building.
But here, actually, I'm also thinking of this, the public buildings and perception. One thing that's also struck me is to put it quite frankly, rather terrible example that's being set by our politicians when they meet, when they have meetings, when they gather. Merkel, you always see with an FFP2 mask, at least, and so do her ministers. And in fact, recently, my husband and I had to go to Germany, and everyone on the streets and in the shops wears FFP2 masks. So not the blue things that really don't do hardly anything. It's kind of pointless, but the proper, FFP2 at least. FFP3 would be better, but still, this is, and it's also about the example that these people set. It's also, why do they? Because if they don't have to wear this inside Parliament, inside parliamentary debates, when they're doing a press conference, all of this, well, why would I then? This is then also, this increases that dynamic. Whereas I think, like I said, at least Merkel wears a mask all the time. But the other thing that I also think we need to really be aware of is the way that COVID has also impacted academic staff. And that's something that's been it has been acknowledged inside the universities, but not in the public debates, definitely not. And also particularly those who have some form of care responsibilities or have extra anxieties or other things to deal with in these times, and extra health issues or whatever. And I think that's something that I'm concerned about, because at the moment it's very much like, if you don't worry about your research outputs, do what you can, But what about 3 or 4 years down the line? Because quite frankly, to put it very bluntly, colleagues who are single, largely male, don't have a lot else to do but to work, they can work fine. Whereas like I have a daughter, for instance, with underlying medical issues. She's not been able to go to school since more or less October. So I'm only able to work from 8 until 1 every day. And I do that 7 days a week. And that's that. So it's kind of this inequality that was always already there in academic systems. And yet the focus on prestige and outputs and all of this really is not okay anymore. And also in this kind of context, that should also be addressed. And also that people's careers, when they're actually working 2 or 3 times as hard, but getting a minimum of results because of their circumstances, that's something that the whole academic system should take more seriously. Yeah. And also, in this sense, I agree with colleagues at other universities who have been calling for an adaptation of hiring practices, for instance. Don't hire the person with the most outputs and the greatest fancy whatever. Look at also who are they? Who are they as a person? Like what kind of people do we want in universities? Do we just want like the high flyers and the so-called, prestige builders? Or do we want those who want to build a community with their students, who want to engage, with their sim, who are also a fuller person in another kind of sense of the world, who want to do other things as well in their lives? And I think also this is important because of the healthy balance, I guess, in terms of how we are, is also the message we bring to our students, who then, still have their lives ahead of them. So it's a lot of topics in one go.
But I think that's a really important point. And I think that that's something that the Netherlands and the wider EU needs to consider, but like also in relation to funding, right? So in relation to like NVO funding or ERC funding, and right now there are, for example, you can get extensions on how long you're eligible for funding if you, for example, for having children. But, is there going to be also a corona clause, right, which would recognize that your research has been on hold because of corona, your outputs are on hold because of corona, which means that you don't necessarily meet the often quite arbitrary and random thresholds for like what is considered to be a necessary CV, right, in order to be eligible for these kinds of grants. Yeah, I mean, exactly. In terms of like, it's considered that, and I'm in part of a big grant at the moment, and it's just basically being considered that we can carry on doing the research that we promised that we would do because of under coronavirus conditions. And I mean, that was kind of possible maybe for the first few months, but now we're over a year now, and our research was supposed to be on the ground ethnographic data collection, and we haven't done it. We're not able to do any of it, and we muddle through. But when we're creative, because we are, that's by our very nature, we're problem solvers in that way. But there's sort of no recognition that, this is actually a problem, and that we're asking, especially junior researchers, to work on their PhDs, even though actually their entire research plan is now completely not possible. I think that this, again, it's not, to me, it's not showing an ethic of care.
Yeah. And I also think, to add to that, I also think that this also points to a wider issue, again, that the emphasis within academic systems is on output. And that's really particular types of output, which is really problematic. It's not only an impoverization of actually academic practice as such, both in terms of the quality of the stuff that we produce, right? As well as, the kind of scope of the things we're able to do. But also it means that, for instance, people who are before Corona even, who have health conditions, who've suffered from, different forms of hospitalization, different other, aspects to do with that. There's always then this thing of, do you put that on your CV? Do you have to, but then they're not going to hire you because, well, if you have had 20 illnesses, well, what's to say you're not, don't have in the future. So therefore you're not a good employee. You're not this productive subject, which again is this re-emphasis on the individual responsibility for your health and your output, so that you're always able to be a productive unit, which is simply also not life. Life really is to use a sort of cheap John Lennon phrase, but what happens to you when you're busy making other plans? And that is what universities should account for as well, and say, okay, life is not, we cannot make it. It's not maakbaar again in Dutch.
And we know that, right? We know that the way that we structure and see what scholarship is, we recognize that it's a collective endeavor, right? We ask and we're expected as scholars to be able to situate our own work within the work of others, within, to build on these foundations, right? So we already know that.
Yeah.
We already know that this is actually a collective effort, and our work is only as good as the work of other people's, right?
Exactly.
And that this notion of like the individual genius is just complete nonsense. It's just nonsense, right? Again, agency, only agency, and no structure. So we already know that. It's not even like this would require like a complete alteration of our ontology or our epistemologies or anything.
No.
We're also doing students a real disservice by having this very can-do work ethic in the middle of a global pandemic.
Yeah.
And there was, I've tweeted about this before, there was that Erasmus television program over the summer where they interviewed a Dutch researcher who said, well, we noticed that international students are more afraid of coronavirus than Dutch students. And they were sort of pathologizing the international students. And of course, they chalked it up to, well, they're far away from home. They're all the stressors of being an international student. What they failed to consider is maybe that was a completely rational response to what we're living through. And I, in my own experience, I've had students who lost a parent, a grandparent, students that were going or who felt extremely uncomfortable living in a dorm where there was an outbreak. Yeah. And I find that there's this sort of the denial that the institution encourages is suffocating for students. What they really need is someone to reflect back to them that, yes, we are in the middle.
But also, in that sense, I've recently heard another colleague at another institution also say, like, well, actually, maybe the universities should have just cancelled, in this idea, just written off the year and maybe just see what we would like to produce. This is a very radical idea that no one would ever agree to, but just say, let it go, and then also see what other form, because we all want to still do stuff, right? Just because Corona happens doesn't mean that our brain stops working and we don't want to think anymore, we don't want to do stuff, but maybe there would have been different structures, different ways to do it, which is, maybe it's unrealistic. At the same time, at the moment, it's this pressured environment for everyone. Yeah. Is really taking its toll.
But there's only one response that seems to me from that pressured environment, or only one response from certain people, like certain, the institutions of, the students are not okay. And then that response is they're not okay because they want to be on campus. Yeah. And again, I think that that's an amplification of a particular group of people and presenting that as the norm, which invisibilizes, erases, gaslights, is a form of violence against those students who don't feel that. Yeah. Right? I don't see their stories and hear their feelings being amplified in the media by our institution in the same way.
Yeah, and also I also think that the other thing is that rather than recognizing all the difficulties that students are facing, which it becomes sort of channeled in this way of, it's just being back on campus, as if that's going to solve everything. And that's just not the case. The case is that we're living through deeply uncertain times with a lot of pressure for everyone involved, a lot of existential and physical anxieties that either some people mask through the strong subject approach, and others just don't. And I think this really is the issue. So basically, it's sort of like we're not addressing the real issues, the real elephant in the room, and diverting attention away. I'm not saying that, if some of it could help students a little bit. That's also why, I would say have the camps open for those who need it, organize perhaps some activities that are not tied to teaching on the outside, small scale, this kind of stuff, right? But also, perhaps rather than just saying we need to get back to normal, it's like, let's just recognize what it is. And
maybe that normal was not also that great to begin with.
No, and maybe it wasn't very normal, really.
Yeah.
Polly, Vivienne, thank you so much for taking the time to speak with me today. And good luck with your efforts at the university.
Thanks.
Right.
And I'll speak to you both soon somehow.
Okay.
I'm sure.
You're very welcome. Thank you for having me. Yeah.
Bye-bye.
Bye.
Okay, bye.
My conversation with Polly Pallister-Wilkins and Vivienne Matthies-Boon was recorded on Friday, April 30th of 2021. Since recording this episode, of course, university campuses in the Netherlands reopened on a limited basis, and they have since made self-tests available to students, tests that they are not obligated to but are free to take before entering campus. And Vivienne sent along an article to me that shows that since this has been instituted at her university, only 30% of students are actually using the tests. So this gives us some idea of how successful that project is likely to be. So I want to thank Vivienne and Polly both for taking the time to meet with me, and I hope that we can push for safer universities for the rest of this year, and especially when they reopen in the fall. Once again, this has been Breaking the Waves, Conversations about the Dutch Pandemic. My name is Matt Cornell. Thank you very much for listening, and please contact me if you have ideas for future guests and topics.